Hi everyone, I'm Adriana. Sorry we're not getting to meet in person this week, but I will see you next week in lab. So what I'm going to do today for you is provide you with some demonstration of the exercises we will be learning. So I do encourage you to view these and watch them prior to coming to lab. And having them in a video form also lets you refer back to them. So you can study from them, or if you have any questions, you can ask me about them in lab or via email. So what we're going to be starting with is the shoulder. Today I'm going to give you the shoulder, elbow, wrist, and hand so that you have them all for the next upcoming weeks and can practice at home if you need to, and then when we come in lab we can do it together. This is the TheraBand. You will all be getting one next week in lab. I will have them pre-cut, and you will take these home with you and bring them to lab each week and keep them, so it's yours. They're super portable, they're not heavy, they're light, they can squish up, you can put them in a pocket or a bag. This is really convenient for your clients as well because it's not big bulky equipment that they need to have or use. So I will be teaching the course with a TheraBand. We will have some hand weights, we will have some other props, and I will give you non-equipment options as well. So there will be tons out there. There are many exercises and stretches for all of the things we'll be doing. I will just be showing you a few and some of my favorites. However, if you have a different one that you prefer or like, run it by me prior to using it in an exam so that I can kind of just give you the okay that it is doing what it needs to do. So with rehab and Remex for massage therapy, this is where you get to add on your Epsom salt take-home section of your plans. So now you can add in some exercises for your clients. So not only will they take that Epsom salt bath, you can give them some exercises to do or stretches that they can also do at home. So with this course, we will be talking about isometrics, isotonics, and self-stretches. Isometrics basically means that you're strengthening a muscle at a particular range. So you will not be going through the full range of motion. You're holding it at a specific angle, and it is going to strengthen that muscle at that angle, as well as any of the surrounding muscles, stabilizing muscles around the joint that's affected. And this is done with no weight. You can use props if you like, but you don't need any necessarily. With isometrics, basically the muscle length is not changing, it's staying at one length. So when you do these can be done every day. The recipe for it would be one set of 10 reps of 10-second holds. So I would hold something for 10 seconds, rest for 1 or 2 seconds, do it again for 10 seconds, up to 10 times. So the recipe for an isometric is 1-10-10. It's the easiest to remember, especially for OP purposes. We have a lot of numbers floating around in our OPs, so this is one of the simpler ones to remember. When we talk about isotonics, you will be moving through the full range of motion. So kind of exercises you see people do in the gym often is where they're doing their full bicep curl or tricep kickback and stuff like that. They're moving through the full range of motion. So you're going to strengthen that muscle through its full range and get its full strength back, hopefully. Those exercises you would recommend someone doing on alternating days or every other day. It's not something they want to do every day because it will be with a load or a weight of some sort that they'll be using. So they'll need the recovery time in between to be able to progress and gain their strength back. So it will be done alternating days, and the recipe for that could be 3 sets of 8 to 12. You could say 8, 9, 10, 11, 12. You can give the range. And you can always reassess in a couple weeks when they come back to you if something was too easy or too hard, and then that lets you play with the number. When we talk about stretching, stretching basically is going to increase their flexibility, it's going to increase their range of motion, it also brings blood flow to the area that's affected, and that can be done every day as well. You could do it 3 times a day, 5 times a day, it doesn't really matter. You can just give a number that you feel comfortable with and that you think they'll be able to do. For OP purposes, a stretch will be held for 30 seconds. However, in the real world, you would let your client know that you would like them to hold it for a minute to 2 minute max to get the full stretch effect. Okay, so with having that said, we're going to start on the shoulder, and we'll start with shoulder isometrics. So with the shoulder, the ranges are flexion, extension, internal and external rotation, abduction, adduction, and then you have your horizontal abduction, and adduction. So we'll be going through those. Again, like I said, you don't need any equipment necessarily. They can use their own body as resistance, or if they have some sort of post or wall they can also do that. So let's start with shoulder flexion. So with shoulder flexion, you know that the biceps aids in shoulder flexion. You have pec major in there. You have your anterior deltoid, coracobrachialis. There are fibers of other muscles that cross as well, but we're just going to focus on the main ones that do this action, okay? So for shoulder flexion and isometric exercise, all you want to do is bring your arm up, and they can use their own hand, their opposite hand, to create that resistance, because what's happening is you're pushing or pulling it against an immovable object. So right now my hand is going to hold it there, and I'm going to try and raise my arm up and push. And this is where you would hold it for 10 seconds, relax, do it again for 10 seconds, up to 10 times, okay? If they couldn't use their hand for whatever reason, they could find some sort of surface. So if they had a table or something, they could push up into the table that way. Or again, if you wanted to use a weight of some sort, they could use something light and just hold it up, because the weight is trying to bring it down and you're trying to fight it to hold it up. So it's using an isometric version of the exercise to hold it, 10 seconds, and relax. So with this, you want to make sure their shoulder is back and down, not hunched forward or rolled, because then you're not really focusing or owning in on the muscles you're trying to activate. So you're holding this for 10 seconds and down. So now when we go to shoulder extension, you know extension goes back this way. So what we're using here are lats, teres major, posterior deltoid aids in this, okay? So with this, you could find a wall or a post or something. They can push back into this way, and I'm just trying to push my arm to go backward, but the post is stopping me. Okay, so I'm holding that for 10 seconds. Another way you could do extension is if you put some sort of pillow or towel behind, you're gonna have them tuck their elbow in nice and tight. What I'm going to try and do is push my arm backwards this way, and I'm gonna push into the post this way for 10 seconds. I'm gonna go back to flexion quickly. So if you didn't wanna do it straight arm, you could also do it this way as well with the towel. So you would have their arm tucked in nice and tight, and now I'm gonna try and push my arm forward this way into flexion. So I would push for 10 seconds. Okay, so that's for shoulder flexion. Shoulder extension would be backwards. Okay, so then we have the AB and adduction. Okay, so we'll start here since we're near the post. If you have their elbow tucked in nice and tight, with abduction I'm trying to move away, but I need something to stop that. So I'm going to use the post here, and you're going to keep your arm tucked in nice and tight. I'm not using my wrist at all, I'm using kind of where the elbow area is, and I'm trying to push up and away into this post for 10 seconds. Okay, if you didn't have that and you wanted to use straight arm, you could use the same post or pull here, and you're going to try and push your arm out this way into the pole. Again, if the surface is hard, you could always put a towel or something that they could push up into. If you didn't have a post or pull, you could use a can of soup or a dumbbell, and they can hold at whatever angle you're trying to strengthen eventually to get to the full range, okay? So then we have a deduction, so you're trying to add to your body. So this is where you could use a pillow or a bolster. Okay, so what I'm trying to do is just squeeze my arm into my side, and I'm going to use the pillow just to use, because that's what I have here, and I'm going to try and squeeze my arm straight down in to the side of my body, hold for 10 seconds. Okay, you could also do it with the bent arm, and you're trying to bring your arm this way, so I'm trying to adduct nice and close. Okay, then we have your horizontal AB and adduction. So the difference between regular abduction and adduction and horizontal is done at shoulder level. So this is where you would be at this level. So if I'm going to abduct, okay, I'm going to use my post, and I'm going to try and push my arm out this way, okay, for 10 seconds. And if I want to adduct, bring it closer to my body, I'm just going to turn my position here and try and push my arm across this way and hold for 10 seconds. Okay, also under your OP section, there are all the testable muscles under what ranges they're doing and what I'm looking for. So please review those as well, and those will help you kind of figure out which muscles are going to do what. So then we have internal and external rotation. Okay, so that's this way and this way. So when I did the AB and AD deductions, I was moving from my elbow. Now I'm going to be moving from my wrist, because what I want to do is kind of turn it outwards. Okay, so I can place that pillow or towel, and I'm going to be trying moving outwards for external rotation. Okay, so I'm not using my elbow to push anymore. I'm kind of using the back of my hand to try and turn it outwards. So I'm going to hold that for 10 seconds. If you didn't have a pole or a post, they could simply just use their other arm, okay, and push against it. For internal rotation, same thing, tuck my elbow in, and now I'm going to try and swing my arm inwards. I'm going to push in. And if you don't have the pole or the post, you can just use your own hand and try and push in this way, resisting with the opposite hand. Now, internal and external rotation can be done at that angle, but it can also be done, remember, up here at shoulder level. So you would be going internally rotating and externally rotating. So again, if you had something to push down into, that would work, or they could use their own hand if that's the case. You could also use your can of soup or your dumbbell, okay? So if you're here and I wanted to hold external rotation, I could hold it for 10 seconds because I'm trying to fight the weight. Or internal, I would just hold it this way with the weight, okay? Ideally, you'd want them to use their own hands or a post or a wall for these ones in the beginning, and then they could progress further with that. So that is your shoulder isometric section. So if you have any questions, we'll take it up next week in lab. Please review these exercises. If you have any other ideas, that works as well. We'll go through that. Next, we're going to be getting into the shoulder isotonics. Okay, can you stop? Stop.